If I can just demonstrate where botulinum toxin can be very effectively used on the face. It can be used in between the eyebrows for the frown muscles, just as demonstrated, and also the bunny lines, just at the bridge of the nose. It can be used to soften the forehead lines, as demonstrated there, and also the laughter lines at the side of the eyes, also known as crow's feet. It can also be used to actually open up the eye by a very small amount, to lift the tip of the nose, lift the corners of the mouth, and any chin dimpling that can be created there by the chin muscle. Some patients present with a high lip line, what we call a gummy smile, where they're showing unsightly appearance of an upper gum. So just by relaxing the muscle, we can then help to take that appearance away. It can also be used for jowls, overbuilt jaw muscles, necklines, and also any areas of muscle tension, be it in the neck or the back or your jaw opening and closing muscles. Some patients also present with an excessive sweating problem, be it underneath the armpits or the soles of your feet or the palms of your hand. So just by relaxing the muscles in those areas can help to diminish the sweating problem. So as you can see, botulinum toxin has both medical and cosmetic benefits. Turning to dermal fillers now. Dermal fillers is a clear gel which can be very artistically and tenderly injected underneath the skin to restore volume that has been lost either with time, pollution, sunlight, hormones, smoking, etc. The gels that I used are hyaluronic acid gels, which is a component commonly found in our skin. So what I am doing is replacing like for like. Common areas are the deep grooves that are formed on the face, known as the nose to mouth lines or the nasolabial lines. And it can also be used to restore the definition of, say, the lips, giving you either a sexier pout or a lip curl of your upper and lower lips. You can add more or less volume to the lips, whichever you desire. It can also be used to soften any smoker's lines on the upper lip, and also to restore definition and change profile of your face. Be it to add volume to your chin, the profile of your lower jaw, add some volumes to your upper cheeks, which can then also help to soften these nose to mouth lines. Dermal filler can also be used for brow lifting, any nasal deformity of the nose as well, so it can help to actually even out the bridge of the nose. Another area, though very rarely done, is underneath the eye. Obviously, when you come in for a consultation with me, I will discuss this in more detail with you, specific to your desires and requirements. So as you can see, dermal fillers can be used to restore a much more natural and youthful appearance. With Wendy, we have done a treatment with botulinum toxin and dermal fillers roughly about a month ago, and I injected Wendy's frown muscle. So if you could just frown for us now, Wendy. As you can see, that frowning capability is gone, and also we did the forehead lines. If you could just raise your eyebrows, great, and also if you could just smile for me, and we did the crow's feet. Now with Wendy, as you can see, as she's raising her eyebrows, she still has an expression, which is what I prefer to attain for my patients, so that it looks a lot more natural. We also went on and put some filler very subtly. Wendy wanted a much more youthful look, but yet not so obvious. So a little bit of filler I injected into her nose to mouth lines, and also we have defined the borders of her lip and just given a little volume. The lips, though, we did roughly about a year ago,
yeah,
would you say,
a year ago
Wendy?
now.
Yeah, it's about a year ago. So she didn't really want anything done this time round with regards to her lips, but this is what can be achieved with botulinum toxin and dermal fillers.